There has been a lot of debate about the province's back to school plan, but what does the science say? A new study out of McMaster University says kids will not be super spreaders or cause a spike in infections if they return to school. Sarah Neal-Stramko helped lead the study and she joins me now. Sarah, can you talk to me about the research you've done and how you came to that conclusion?
Absolutely. So we looked at all of the published or released reports, scientific reports and government reports from around the world, published up until July 20th, 2020. So overall, we included 33 different reports from 16 countries, both things that were released prior to lockdown. So when a child had gone into a school or daycare setting and later found out that they had had COVID-19, and then in jurisdictions that have reopened after lockdown. And what we see overall is that the risk of transmission amongst children in school and daycare settings is low, especially for children under the age of 10. Over the age of 10, children, as they get older, seem to look more similar to adults in the way they transmit the virus. But when we do see outbreaks or clusters that have occurred in school and daycares, they have been primarily traced back to the adults in those settings.
Your team also looked at household clusters of COVID cases. What did you find there?
So there again, we do see that predominantly the transmission is related to adults. So adults seem to be what we call the index case, so the first person to transmit the virus. There is a little bit of difficulty in those studies in really identifying who might the index case be. And we know that children, especially when they're at home during lockdown, are kind of exposed to some of the similar things that their parents are. So those ones are a little bit more difficult to interpret, but again, we see the index case and the transmission primarily being traced back to the adults in those settings.
So now research is harder when it comes to school because obviously not many kids are actually back to school, but what have you found about that?
So although here in Canada, we are just starting to prepare for back to school across the country, but there are a number of jurisdictions that have gone back already, and it's places like Sweden who never fully locked down. So we can learn a lot from those places, both in terms of how to do it safely, and we do unfortunately learn from other places such as Israel as to what kind of are the factors that are involved in outbreaks in the school settings. We have seen those as well.
The research shows, as you said, that as kids get older, they will spread the virus. What does that tell us about possible preventative measures needed for small kids versus, say, high school students?
Absolutely. So I think it is one of, I guess, kind of the good notes of COVID-19 is that our young children seem to transmit much less likely than the older adults. And I think this is good news because we also know that our younger children are probably the ones that have a harder time maintaining their physical distance, are not our best hand washers, have a harder time keeping a mask on all day. So I think it's a bit reassuring on that end. I think with our older students, our high school students, keeping those public health measures in place like physical distancing, hand washing, masking where appropriate is really important.
What are some things that parents can keep in mind? We're about a month out from school starting in Saskatchewan. What are some things that they can do now and things that they can keep in mind as we get closer to back to school?
So seeing the data from around the world that shows that most of the outbreaks or clusters are really traced back to adults and are really contained to the adults in those settings, that's one thing that parents can control really well. So making sure that when they're doing drop off and pick up, that they're really maintaining their distance from other parents who are in the parking lot or maybe in the hallways, making sure that you're really encouraging proper hand hygiene before and after school, mask wearing yourself, and making sure you're still continuing, although students are back in school and have sort of broken the bubble, I guess, that different provinces have put in place and are exposed to other families, making sure that you're still keeping your guard up when at home, making sure doing all the things that we can continue to do, I think is really important to keep in mind as our students go back to school.
Sarah, thanks so much for your time today.
Thank you.